I'm Dr. Agnes Maigallo. I'm a counseling psychologist. I have a PhD in counseling psychology, licensed by Kenya Counseling and Psychologist Board as a psychologist. I'm also a mental health practitioner. I have done an advanced diploma in mental health practice. I'm also trained in addiction treatment and addiction prevention. And recently I was accredited as a court mediator. My background is that of a teacher. I've been a transformation coach for quite a long time. And in my career life, I've looked at so many other issues, and I'm realizing mental health is everything that we need to sort for people to live successful life. I want us to very first look at what is that threatens our mental wellness. What are the threats? And this affects every one of us, me included. Whether we realize it or not, each of us has something that threatens their mental health. We are not talking of just stress from a difficult day. If you're able to realize this stress because my day was bad, that's a good step towards mental wellness. But what is that threatens your mental health? Most of them are real. Most of them are even forces we don't see. They're things we don't see. These things can either slowly pull us away from being okay, or they can suddenly make us not okay. Let's dive into them and ask ourselves. One thing I want to give a disclaimer or a warning is, as I go through them, you may recognize them. You may realize even more than one might be threatening you. But please stick, because there's a solution to every threat. We may not do it today, but we shall look at those solutions. But I'll just touch a little bit on them. Now, let's look at the biological threats. Those of us who studied biology, and now being Kenyan, we are talking from a Kenyan context. We talked of genetics. That is the genes we inherited from our people, from our parents. Some of us have a family history or with mental illnesses. You may have a family history of depression, a family history of anxiety, a family history of bipolar disorder or schizophrenia. That's a risk factor, but it is not a death sentence. I don't want to get into deep stories about hormones and how they affect us, but this is because there are these neurochemical imbalances. There are imbalances in the serotonin, in the dopamine, that mess our moods. And as we talk of the genetics, also remember another biological factor is our hormones. They play a huge role into determining our mental wellness. For example, when you're dealing with an adolescent, they have severe mood swings. If you don't understand this child, you will push them to mental illness. You need to guide them. Pregnancy. Sometimes after delivery, we also have hormones disturbing us. Other times, towards menopause, premenopausal and postmenopausal syndromes. All these things are a risk to our mental wellness. They can trigger and worsen mental health struggles. Let's say, for example, I go to the next one. I'm struggling in my relationship with my spouse. And then I'm approaching menopause. Things may go south. The other thing that we cannot ignore in biological threats to our mental well-being are illnesses, ugonjwa, physical illnesses, more so chronic illnesses. Imagine someone who has an heart disease, or someone who has who is diabetic, someone with autoimmune conditions, someone who has had chronic pain, someone struggling with cancer, someone struggling with HIV. Those, even if they try to be happy, these are threats to their mental wellness. So imagine now the stress of managing these chronic conditions, stress of managing diabetes, the stress of managing an heart condition, the stress of being dependent on someone because you are unwell. Then the biological effect these illnesses can have on the brain, it can be a double hit. This person can be badly hit, and their mental health may go south. They need a lot of support. Now, the other thing we cannot forget is substance use. Use of alcohol, use of marijuana, opium, over-the-counter drugs like tramadol. Some people have resorted to taking even diazepam to help them manage their distress. All these things biologically affect our mental health. Why? We will come to look at alcohol and drug use later, but these things rewire our brain. So this is the way our brain is wired, and these ones alter how our brain functions. So, and then immediately they affect us. When they affect us, we want to stop them. We want to leave. And now the withdrawal hits. That is why I always recommend, if you have a substance use problem, please run to a psychologist and be helped to get out of it. In Kenya, substance use is becoming like a fashionable lifestyle. It isn't. It is a psychological storm. It is a threat to your own mental health, one of the major threats. And the only way for the youth is to please don't get into substance use. And if you are there, before it messes you, before it denies you the happiness, the joy, the potential of being the best version of yourself, please seek help. And anybody who is affected by substance use, I want to promise you that with support, you can live a happy life. So, those are the biological threats among many more.